Katie.
Hi.
Welcome back. My name is Dr. Matt. I'm going to do your exam.
Okay.
So, let's see. I have here your file. Can you please verify your date of birth?
Sure, it's March 23rd, 1989.
Perfect. So go ahead and tell me what's going on.
I've been having some stomach pain lately, just like a lot of tenderness and soreness, especially near the belly button, kind of in the middle area.
Okay.
I don't know what it is. Sometimes it gets a little red too, like it isn't today, but a few days ago it turned red for a few hours. And also I'm having back pain, just like in my midsection of the back, kind of on either side of the spine. Just a lot of tension, and I don't know if that's related or not, so that's why I'm here.
Okay. I can definitely take a look and see exactly what's going on and try to find the cause of it.
Okay.
Okay. How would you rate your back pain on a scale of 0 to 10?
I would say it's about 6 or 7.
It's pretty intense. Have you been
Yeah.
taking any pain medicine?
Ibuprofen.
And for the stomach pain, you said it's around the belly button.
Yes.
Have you been taking any medicine?
No, not for that. I'm just not sure what I would take. It's just like a soreness that won't go away.
And is this the first time that you're being seen for this issue?
Yes. Yeah.
Okay. Are you taking any medicine on a daily basis?
Yes, I'm weaning off of Wellbutrin, so I'm taking only like 25 milligrams a day, which is a really low dose, and trazodone at night to sleep.
Okay. Just in case we need to prescribe any medication to make sure that it doesn't interact with what you're already taking. Yeah. Perfect. Okay. Okay, I'm just going to go ahead and put gloves on. And how would you describe your abdominal pain? Is it sharp or dull?
It's dull, yeah.
On a scale of 0 to 10, how would you rate it?
It would be about an 8 if you press on it, yeah.
Okay, I'm going to put this on your index finger. Go ahead and relax. And we'll wrap this around your upper arm. Okay, I'm going to have you uncross your legs. This is going to feel a little bit cold. Blood pressure is a little bit elevated, so we're going to make sure that we have that in your medical records. Heart rate looked normal and oxygenation is good.
Okay.
So I'm going to keep an eye on it. We want to make sure that if it is an infection, we treat it properly with a broad spectrum antibiotics.
Okay.
But first, I'm going to need to take a look and see exactly what we're dealing with to see if there is any fluid that we could test.
Ooh, okay.
Okay. Blood pressure was 135/60. Systolic a little bit elevated. Heart rate was 70 normal. And then oxygenation was 95% on our meter. That's also normal. Alright, let's go ahead and take your temperature. Alright, this will go on your forehead, so go ahead and relax. 96.6. That's a very good sign.
Okay.
Did you take any ibuprofen before coming in?
I did, yeah.
You did?
Yeah.
Okay. Then the ibuprofen might mask any temperature spike if you are having any. Did you experience any flu-like symptoms?
No, I haven't. I haven't felt feverish or chills, nothing like that.
Okay. I'm going to have you lay down and I'll take a look at your stomach to see and your abdomen to see if there is anything concerning, okay?
Sure.
All right. Okay, Katie, is it okay if I lift the shirt up a little bit?
Yeah, go ahead.
And do you mind if I unbutton the pants?
Not at all. Go ahead.
Okay. Let me go ahead and take a light here. I'm definitely noticing a little bit of redness around it. Some swelling. So how long ago did you notice the redness around the belly button?
That happened like 3 days ago. Yeah.
I'm going to listen with the stethoscope. This is going to feel a little bit cold. I would say definitely diminished sounds, especially in the center of the abdomen. And before I palpate, I'm just going to go ahead and take a sample.
Okay.
So what we're going to do is I'm going to sample and culture it to see exactly what kind of bacteria we're dealing with. And also I'm going to check for any fungal infection. going to take a few measurements here. We're looking for inflammation. We want to make sure that all 4 quadrants are symmetric. Going to feel kind of like a pinching sensation. We're looking for hydration status. Okay. So now I'm going to go ahead and check your back. Okay, Goody, I'm going to go ahead and put your hair up so that we can take a look at your back. Okay, before I start palpating, I'm just going to go ahead and listen. This is going to feel a little bit cold. Okay, everything sounds good. I'm going to go ahead and percuss. Going to palpate. We're looking for any swelling. Checking for spine misalignment. I'm not sensing any signs of scoliosis. We're looking at shoulder alignment. Just a deeper palpation here. We're checking for deep infection. Let me know if you feel any kind of pain as I'm palpating. I'm going to take some measurements. This is going to feel a little bit cold. there's definitely some inflammation at the base of the lungs. Although it does look like it's muscular, I don't think it's originating from the belly button. So they might be just two different issues. I'm going to touch you on left or right of your back. Go ahead and tell me if you feel this on the left or right.
Right. Right. Left. 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 Right. 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 Left. Right.
And now I'm going to touch you with a different texture. Go ahead and tell me if you feel this warm or cold.
Cold. Warm. Warm. Cold. Warm. Cold. 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 Warm. 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 Cold. Cold. Warm. Cold.
And now I'm going to touch you with a warm and a dull object. I'm going to need you to tell me if you feel this warm or dull.
Dull. Warm. Warm. Dull. Dull. Dull.
And I'm going to introduce cold as well at some point. So go ahead and tell me if you feel this cold, warm, or dull sensation.
Sure. Dull. Cold. Warm. Dull. Cold. Dull. Dull. Warm. Dull. Cold. Warm. Dull. Dull. Cold. Dull. Cold.
And now I'm going to introduce a fourth object, which is going to feel kind of like a sharp sensation. This is what it's going to feel like. So go ahead and tell me if you feel this cold, warm, sharp, or dull.
Okay. Dull. Cold. Sharp. Warm. Warm. Sharp. Dull. Sharp.
there's definitely a sensory problem. What we could do is to take a sample of the skin here as well and to see if it matches the same bacteria or, flora that's growing on the abdomen. Okay, I'm going to just take one more sample here. And we're going to send this to the lab.
Okay.
Okay, this is going to feel warm. And first I'm going to start with a sensory brush. It's going to help to reduce inflammation. You use cupping therapy. This is going to help to stimulate blood flow. I'm going to apply some acupressure therapy around the paraspinal muscles. This will help decrease inflammation in the area and activate the lymphatic drainage. also going to use a gua sha to help release the toxins from the soft tissue. Okay, I'm going to have you get dressed and we're going to talk about what other tests we should do, okay? Okay. All right, Katie, I'm just going to go ahead and remove my gloves. And I would like to order an MRI for you.
Okay.
All right, so we're going to do an MRI of the abdomen and back just to double check for any infection and to see if we need to order any antibiotics, okay?
Okay, all right. Sounds good.
And are you allergic to anything?
Not that I'm aware of, no.
Okay, so we're going to do an MRI. And if we can't find the source through the MRI, then maybe we're going to go with a CT scan with contrast.
Okay.
As soon as I have the blood culture ready, I will send you an email and we're going to start a course of antibiotics. I just don't want to start it right away. I want to make sure that we are targeting the right bacteria.
Infection. Okay. All right.
Do you have any questions for me?
No, not at this time, but you've been really helpful, so thank you.
You're welcome.
Yeah.
I'll see you soon.
All right, bye.
So I read in your file that you're having some hip pain.
Yes, it kind of started about 3 weeks ago, and I was doing a lot of different things to make me active. Like I was moving apartments, and I was lifting a lot of heavy things, and also I just entered a dance class, and it was just like a lot of hip movement because it's salsa, and so I feel like I was just really committing to the movements, and somewhere between moving and the class, my hips have been killing me lately. Yeah.
Okay. And is it on both sides or?
Yes, yeah, both sides.
And how long ago did it start? You said 2-3 weeks?
Yeah, about 3 weeks ago.
All right. Are you able to walk normally or are you in a lot of pain?
I can walk pretty pain-free, but it really hurts to sit and stand. And sometimes going down the stairs really activates the pain.
Okay. Do you feel it more on the side or in the back?
No, I kind of feel it all around. It's hard to pinpoint. It just kind of radiates, even in the front as well.
Okay.
Mm-hmm.
This might be from somewhere a little bit more above, so I'm going to take a look at your shoulders and see if we need to do any adjustments there, or if the spine is misaligned. Sometimes that can trigger a pain down the buttocks, and you could be having something like sciatica. We're going to take a look at your feet as well. Are you still wearing those insoles?
I am. I feel like they've really helped, at least when I run. So, yeah.
Okay, yeah, so keep wearing those because you have flat feet and that's going to help to not develop any other problems as we're getting older. Have you noticed any difficulty with your range of motion in your neck?
Not in my neck, no.
Okay, what about shoulders?
I do have shoulder pain, but that's kind of been like, I think it might be fibromyalgia. It's something that I've always had that I've just kind of gotten used to, but maybe there's something you can look into there.
Okay. Do you feel that this pain is different than the other ones that you've had?
The hip pain is new. Yeah, the shoulder pain is kind of just always there.
Yeah, because you've been here with some shoulder pain before,
Exactly.
so we can definitely take a look there. But we're gonna start with the hips and see how we can help you.
Okay, thank you.
I'm gonna have you stand up.
Sure.
Okay, Katie, go ahead and just take a few steps relaxed. We're looking at your feet. I'm just checking to see if your condition aggravated in any way. I'm gonna have you turn around. Very good. And keep on walking. Good. Turn around. All right, come towards me. Okay, so just go ahead and stay right there. I do see here your toe is a little bit more inverted than before. Is this causing you any problem?
Not that I'm aware of, but maybe it could be.
Okay, you do have a scar right here.
Yes.
Okay, let me take a look at your back. Okay, left foot is definitely more inverted. I'm noticing a slight pronation here. Okay, any pain on the heel as I'm pressing down?
No.
Okay. Alright, so what I'm going to have you do is I'll have you push in front of you with the heel down. Choose one leg. There you go. Okay, so that's a little bit tight here on the right side. Come back to center and switch. Okay. And come back to center. Alright, so I'm just going to go ahead and check your sacrum here. Slowly palpating to see if there is any inflammation around the plexus. Alright, I'm going to have you do exactly the same thing that you did earlier. So to push down with the heel in front of you. Okay, good. Come back to center. And now do that again with the left heel. Okay, and come back to center. Alright, now I'm going to have you lift the knee up in a 90-degree angle. Okay. Come back to center. Let's do that on the left side now.
Okay.
And come back to center. Okay. The muscles in the lumbar area are extremely tight. So that can mean a lack of oxygenation, but it's definitely caused, it comes from the feet. I think we're gonna have to change the insoles for you and just upgrade and try a new version.
Okay.
Just going to palpate now the thoracic area. Just palpating the scapulas. Alright, starting with the right side, I'm going to have you lift your arm 90 degree with your body. I'm looking for any gaps. Okay, now I'm going to have you lift it all the way up above your head. Okay. And come back to center. Let's do that on the left side as well. Let me find a point first. Okay, go ahead and first level with the shoulder. Good. Okay, and now go ahead and lift it up higher Then your head. Good. Above your head. Okay. Extremely tight here. I just feels like a spasm. It's extremely rare. I think like 1 in 10 years I usually.
Oh no. Okay.
And I only read about it, so this is pretty tight this side. Go ahead and relax.
Okay.
Looking at the shoulder blades, we're looking for any muscle spasms that we could visibly see. So I'm going to have you turn your head like this towards the right side.
Okay.
Come back to center. And do the same thing slowly towards the left. All right. Still left side. Come back to center. Touch your chest with your chin. Come back to center. And now arch your neck. Look up. Any pain?
Some slight pain.
Come back to center. Okay, it's not that bad. It's not that bad. We can definitely fix it today.
Okay.
All right, I'm gonna have you lay down. So we're gonna start face up, okay?
Okay.
All right, I'm gonna have you relax. And I'm going to check first the left side. Okay. Going to apply a little bit of oil on here.
Okay. That feels really good.
So I'm going to go ahead and work on the lymphatic drainage first. That usually helps to bring down any fluid that you're having in here, and it's just resistant to drainage. It usually causes a lot of inflammation and tightness in the neck. Is this better?
Yes, that feels amazing.
Are you having a lot of neck pain?
Not so much, no, but this weirdly, you doing this to my neck feels really good in my shoulders. Like it's really soothing.
It feels very crunchy, so there's definitely a lot of tightness around the fiber muscle. Okay, let's go ahead and do a little bit of the other side too. Any pain here?
No, it feels amazing.
Alright, I'm gonna have you relax. Take a deep breath in and breathe out. And we'll do that one more time. And exhale. How does that feel?
So good.
Okay. Perfect. Yeah, I think it feels a lot better. And I'm going to go ahead and move down to the shoulders and see how we can adjust them. Right. Just gonna use some points here that we definitely need to loosen up.
Okay.
Any pain as I'm pressing down? Slightly.
Slightly, yeah.
Okay. Just trying to put back the shoulder joint. Okay, a little bit of a spasm there. I'm gonna have you relax, okay? Breathe in, breathe out. Good. Okay. Relax your hand. Good. Okay. All right. Go ahead and breathe in. Breathe out. Good. We're just elongating your arms here. Stretching those ligaments. Let's take a look at your legs. Okay, so just stretching your leg here, making sure that we're moving those hips a little bit. Okay. Stabilizing the hips. Okay. Go ahead and relax. Okay, so none of the toes wanted to crack. It's okay.
Go harder.
Okay, perfect. Let's go ahead and adjust your hips now. Okay, this one is going to be fairly easy. So I'm going to have you put your arms like this around you, crisscross. Perfect. And I'm going to have you flip a little bit on the right side of your shoulder. Okay. Yep. Bend this knee. Perfect. I'm gonna have you take a full deep breath in and then exhale. Perfect. Let's go ahead and check the other side. And we'll do the same thing. Go ahead and flip on the left side of your shoulder. I'm gonna have you bend this knee up. Good. Take a full deep breath in and exhale. Good. And relax. All right, I'm gonna have you flip over on your belly, okay?
Okay.
Just going to slowly check for any tension in the calves. Okay. Going to perform a little bit of skin pulling therapy. Okay. Very good. So I'm going to have you take a full deep breath in and breathe out. Okay. Now I'm going to have you lift your legs in a 90-degree angle. Hold them like that. And on the count of 3, I'm going to ask you to take a deep breath in and hold it for 3 seconds, okay? 1, 2, 3. Hold it. And breathe out. Very good. You did great. All right. So I'm going to work on your hips primarily. So we really want to massage those hip flexors. Those are very tight. And I would really like to show you some stretches that you can try at home. Okay, so let's go ahead and also work on lymphatic drainage. This should definitely help to rebalance your muscle stability. I'm going to have you sit up and we're going to adjust your shoulders. Okay, Katie, I'm just going to go ahead and palpate your shoulders first. So we're looking for the spots that are a little bit tighter, and these spots usually help to tell me which part of the spine we really need to press on so that we can readjust your shoulders and bring balance into the line. Okay, perfect. So what I'm gonna have you do, I'll have you take a deep breath in and breathe out, okay? And breathe out. Good. And we'll do that the same thing on the other side. Breathe in, breathe out. Good. Okay, that felt a little bit better. So I think we were really able to work on the upper spine. You're gonna feel it on the lower side as well.
It's already a lot looser. Yeah.
All right. So I'm gonna have you do a few stretches. It's going to help to minimize the tension in the hips, and apply some cold and heat alternating between them. So maybe 20 minutes heat, take a break, and then 20 minutes cold, and that usually helps with inflammation. And do you have any questions for me?
No, this felt so good. I feel like completely renewed. So
I'm glad.
yeah,
It was very nice to meet you again.
really good to see you
Okay.
again. Right.
Hi, Katie.
Hi.
How are you?
I'm really good today.
Great. Thanks for coming in.
Yeah.
I'm going to go ahead and take a look at your face.
Okay.
All right. Just going to put the hair a little bit in the back here. Any skin issues that you would like me to address?
Today it's feeling a little bit dry. But usually it's just normal combination.
Okay.
Sometimes I have fluid under my eyes, like just a little bit of build up if I get tired.
Okay.
Like bags.
I know you work a lot. I'm going to go ahead and start with aromatherapy. Go ahead and put your palm like this in front of you. I'm just gonna put a little bit around your wrist, and I'll have you rub your wrists together. And just put your hands like this and breathe.
That smells so good. Thank you.
Okay, I have warm towels here. I'm going to wipe your face first so that we remove any impurities. Starting with the eyes. And you can relax your head on the chair. A little bit of redness and puffiness around the eyes. that can be related to extra hours that you've been putting in, working really hard. Are you experiencing any burning sensation?
No, it feels really good.
Okay, let me know if this feels too hot. I'm noticing a little bit of redness, so we're not going to do a very harsh treatment. I'll be focusing mainly on the muscles, and it's really going to help increase circulation. And we're going to work on like face reconstruction to lift some of the muscles and allow for better blood movement. Okay, I'm gonna have you turn your head towards me. I'm going to apply a detoxifying sheet mask with honey. It has antibacterial properties. this is the first step that we're doing towards cleansing the skin. Keep your eyes closed. I'm going to use an acupressure tool to stimulate blood flow, starting with the forehead, applying gentle pressure. This also helps to stimulate blood flow towards the sinuses and help you breathe a little bit easier, especially at night. Going to apply the collagen infused serum. ice can help with inflammation and puffiness, so it helps to decrease some of the fluid that has been accumulating. Just go ahead and turn your head a little bit towards me for effect. I'm gonna use cold rollers. I'm going to apply an anti-inflammatory oil. I'm going to apply a hydration mist. Go ahead and keep your eyes closed. We're using electric impulses to stimulate the nerves and to make sure that we are allowing a proper blood flow to the area. Focusing on the forehead lines. It's going to feel a little bit cold. I'm going to use gua sha to work on the smile muscles. It's going to feel a little bit cold. We're going to do the same thing that we did on the left side. So far, I'm not noticing any redness. Okay, this is going to feel a little bit cold as well. I'm gonna have you turn your face towards your right. Perfect. So we're gonna work on the jawline.
Sorry, I'm falling asleep.
That's okay. No worries. I always like to work on the decollete area and the neck muscles. to scalping therapy. So we're going to start with under the eyes. This will definitely help for the blood to be pulled towards the surface. It helps to remove any toxins that have been accumulating. This is very gentle on the skin, especially the skin under the eyes. Go ahead and turn your head a little bit towards me. Okay, I'm going to apply hydration mist. This is going to help with skin rejuvenation. It helps for the skin to maintain moisture. going to go ahead and shape your eyebrows a little bit. Going to apply a calming oil. Now this is going to be cooling water. Okay, perfect. Now I'm gonna have you turn around and I'll take a look at your scalp. Thank you. Okay, I'm going to divide the scalp area into two main parts. Now I'll take a look at the right side. And I want to see if there is any dryness, any scalp conditions that we are working with. And then we're going to do a full scalp treatment. Probably I'm going to take some samples so that we can figure out exactly the type of scalp that you have. You've been having a little bit of dryness and itchiness, correct?
Yes, it's been really itchy.
Okay. So I'm going to apply a basic solution. This helps to lower the acidity of the scalp so that we can take a proper sample. Going to send this to the lab. Okay, take a look at the hairline. Noticing a little bit of swelling around the neck. So I'm going to apply an anti-inflammatory oil. That's going to help to lower inflammation. This is going to feel a little bit cold. going to apply this along the neckline. I'm going to perform hair pulling therapy. I'm going to move to the left side. especially around the ear. We have to make sure that there is no inflammation. Scalp looks very clean and healthy. What I'm gonna do is I will do a test for a vitamin deficiency, and if needed, we're going to prescribe some medication that will help with hair growth. This solution helps to prepare the side so that we can do a proper extraction. going to send that to the lab. Then we're also going to do hair pulling therapy to make sure that we are increasing blood flow to the scalp. It also helps to reduce tension and reduce scalp tenderness. session. Thank you for allowing me to take care of your face and scalp.
Thank you.
Can you please verify your first and last name and your date of birth?
Sure, it's Katie, ASMR, March 23rd, 1990.
Do you have any allergies to medications?
No, not that I'm aware of.
Are you taking any medicine on a daily basis?
Yes, I'm taking Wellbutrin and trazodone at night to sleep.
And do you have any skin conditions that you would like me to address today?
I used to pick my skin when I was a teenager, and so I have some scarring from that, along with chickenpox, and just some very small blackheads on my nose and chin, but otherwise, no issues.
Have you noticed any dry patches around your chest, arms, or in the back?
No, I moisturize pretty religiously, so my skin is good.
Okay. Well, today I'm going to do a very detailed skin exam. I want to make sure that there's no vitamin deficiency, and we're going to try to give an approach to how you should hydrate your skin to make sure that it stays healthy.
Okay.
I'm also going to look for any pathologies, anything like that, to ensure that you are on the right track.
Okay.
Okay. Perfect. I'm going to go ahead and sanitize my hands. I'm applying gloves. I'm going to go ahead and first inspect your skin. So I'm going to using a magnifying glass to check for anything abnormal.
Okay.
Come a little bit closer. Okay, I'm definitely seeing clogged pores. A few scars. Okay, I'm going to examine your chest as well. Looking for skin conditions that are very easily treated. Okay. Looking for skin elevations, abnormal bumps. I like to take a look at the skin under the eyebrows as well. Sometimes there could be certain skin conditions that are hiding in between the hair follicles. Seeing a few moles, but they do look normal in size. I have no concerns there. Just looking at the skin surrounding the eye. Definitely, it's something that I want to address. Seems like we need a little bit more hydration around here, but I'm going to do a few tests to check hydration status. Okay, I'm going to check the chest area as well. Do you wear sunscreen?
Only on my face and only sometimes.
Okay. Definitely sunscreen can be applied on the neckline and decollete area, wherever there is sun exposure. This area is very sensitive and it needs lots of personal attention. I do see lots of freckles. These can be developed throughout a lifetime, especially as an adult. I'm going to do a hydration test. So we're taking samples from different parts of the face. say that we're checking for hydration, I don't mean necessarily to say if you're drinking enough water or if you applied enough moisturizer. It's more to check how well the muscles and the fiber right under the skin is hydrated in a sense of a holistic approach. So we're looking at vitamin levels, sodium, potassium, magnesium levels, all the necessary minerals that are needed for proper exchange of ions. Okay, I think we have enough of these for the sample. I'm going to go ahead and use a special solution. I'm going to take different samples again. Good. I'm going to apply an oil. First, I want to see if there's an allergic reaction to it. So I'm going to be looking for any redness. This is in a very small concentrate, so it's very small dosage. I'm going to let it sink in for a few minutes. Now I'm going to do a hydration test. Okay, 36%, that's definitely on the dry side. %, that's a little bit better. 40%. 100%. Going to test the scalp area as well. %. Okay. Going to write all of these down. I'm going to apply some stickers that will help us remember the sites and the points that we tested. Okay, perfect. I'm going to go ahead and move down to the arm area. Okay. I'm going to use this sensory brush to desensitize the skin first before we take further samples. Removing any impurities. It's gonna feel a little bit wet. Now I'm going to take a sample. We're going to send this to the lab. This is going to help to neutralize the solution that we just applied. Okay, Katie, so I'm gonna have you flip over on your belly and I'll take a look at your back. Okay, to go ahead and write down what we did so far. So we also examined the arm and we used the right upper arm. Take the samples. Okay, we did a hydration test. We're also going to check for mineral deficiency. And also we're going to check for any forever substances. Sometimes these substances are absorbed through clothes, so I want to make sure that if it's absorbed through clothes or nutrition, that we are aware of the level of it and we know how to treat it. Checking for redness, skin lesions, normal moles. I'm also looking at the size and color. And I am noticing a few that are a little bit raised. We can take samples and send them to the lab, see if they have any abnormal growth. Okay, I'm going to do a pH test. There are a few moles that I'm noticing. Applying a purple color, purple dye to see if we are noticing anything abnormal. I'm only focusing on the ones that have either a raised structure or they're asymmetric or they have a combination of different colors. And I'm also focusing only on the larger ones, and you don't have too many. I found a few. I'm going to go ahead and mark these as well. Perfect. Okay. Now I'm going to go ahead and take a sample. We're going to look for that abnormal response to see if the moles are developing faster than normal. Okay. Going to apply neutralizing serum. I'm going to apply a spray that will help to bring up the hydration level, especially on the skin on the back. Also, it helps with inflammation and to increase the volume of blood that flows through. Okay, so I'm just going to go ahead and cover your eyes. It's going to feel a little bit cold and mentally. Apply a little bit more. Alright, I'm going to go ahead and send these to the lab. To write down all the tests that we did. So we did the blue paper, we applied hydration cream, okay, neutralized the skin and lowered the pH. Okay, also we worked with mist spray and I applied a burn for itchy skin. That's what it is for the spray, which has like a menthol. Okay, perfect. Thank you, Katie, for coming in. We did lots of tests today, and I'm going to go ahead and prescribe some medication that will help your skin feel a lot better. I'm going to go ahead and put the gown back up and let you get up on your own time.